Welcome back to Moving Science, the podcast where we dive into the latest breakthroughs shaping the future of medicine. I'm your host, Dr. Agne Straukiene, neurologist and MS service lead at Torbay South Devon NHS Foundation Trust in the UK. I'm also a founder and a host of the Be Well with MS podcast. So we discussed in the first segment all about the using AI, what is the access, what are the challenges around, what are the future, and just broadly speaking about amount of the healthcare information available online and how do we see AI playing a role in making the information more accessible and useful. Now moving on to second part of this interview, I would like to bring Professor Wiendl again into the fascinating discussions that we had in the first segment, but continuing that conversation, which I can't wait to explore even deeper and understand about the regulations, emerging AI tools, ethical implications, and explore some example cases. So let's dive into this conversation and see whether we could bring more enlightening experiences for the listeners of this segment and the entire episode of Moving the Science podcast.
Yeah, hi, Agne. Pleasure to be here again, and thanks for having me. This is an extremely relevant topic. It's support of diagnosis and treatment decision, often referred to as clinical decision support systems. Some of them do increasingly use AI, others do not. So that means support tools or medical devices that can support in the diagnosis and treatment. They don't necessarily need AI in the background or in the foreground, but increasingly they do. And I'm not aware of any very concrete example for establishing diagnosis or improving diagnosis in multiple sclerosis, while in other areas we have clear examples. So in the last episode, I already made the example of skin recognition tools that exploit AI. So you load your image into a system, a software tool, and you're getting back the top list of diagnosis or the concrete diagnosis. And that is very close to, I would say, this is an AI-assisted tool that supports or it makes the diagnosis. And here I would like to add already one point that I believe that almost all the applications, in my opinion, are better suited to be co-pilots. So don't rely on AI. But there could be at some point a change in the argumentation to say, well, isn't AI better or more reliable or better informed and more actual than a doctor, and have you consulted AI? So I'm trying to tie in an aspect that we have to carefully consider, that with increasing use of AI, we might very much more rely on AI, which then makes AI the one to really create the diagnosis for us. And I just made on purpose the example of the dermatologist, because in a way they will lose more and more their skills because they rely more and more on such tools. And in a way, in the end, the tool is the decision maker. So that is, I would say, an ethical element that one has to be aware of, I feel. I don't see this at this point in neurology. I mean, neurology is more like puzzling multiple things together. And if the puzzle fits together, then there is a likelihood that you get a picture, and the picture is the diagnosis. There is very few diseases where a simple lab test does it all for you. And just look at multiple sclerosis. You have to have fulfillment of clinically laboratory, mainly for differential diagnosis, imaging criteria, electrophysiology criteria. And if this all fits together, then you make the diagnosis. In very easy cases, it could be done easier. And at that point, we do not have a simple blood test, for example, that establishes the diagnosis. But there is other diseases where, for example, NMOSD, presence of aquaporin 4, makes things much easier. But what I'm trying to say is that neurology is not a use case where it is as simple as, for example, in dermatology, where just looking at the lesion is the diagnosis one 2 or 3. In neurology, it's always a more integrating complexity, which, and let me add that, which is a clear use case also for AI, because likelihood of diagnosis in a symptom combination, particularly for rarer diseases, is something AI clearly can help. Because I mean, we're facing in neurology, I'm not talking about neuroimmunology only, we're handling more than 1,000 diagnoses, and very rare diagnosis as well. And that is something that AI is very good in. So you're giving 3 spots on diagnostic elements like optic neuritis, previous history of myelitis. What could that be? I mean, every trained resident would know that, but maybe not every outpatient care practitioner or GP. And that's something where this is like the crossroads between AI establishing the diagnosis or supporting in what could that be, establishing differential diagnosis. This is something AI is very powerful in.
Yeah. Wonderful. Just to add on, dermatologists are lucky because they have a lot of visuals, and the AI learns on the big data. When you produce a lot of imaging, it can draw the conclusions and guide the physicians towards the accuracy of the diagnosis and the treatment plans. However, I recently spoke with my very best friend who is a dermatologist, and she runs her private dermatology clinic. And she says, you know what, Agne, I appreciate what you're saying about using AI to capture the lesions of the skin, but she says, I don't trust AI. I still have to look by myself using the dermoscope, which is even more sort of a tool that allows to zoom in into the skin tissues and describe the lesions that are, it's the whole science behind, and really, I think we believe that the other grass is greener, but I think there are some challenges to any specialty that are utilizing AI widely. Our topic of episode is education and learning from the condensed information that AI is able for us to combine and segment into the structured plan for us to learn to make the decisions and maybe diagnosis. Are you aware of the AI tools that are being used by the healthcare professionals already for decision making and treatment plans? Maybe something that is emerging in multiple sclerosis, and you could share this information for us, moving away from other specialties into more MS field. Any tools, co-pilots available already?
I'm aware of a couple of products that are either in development or already at a commercial stage. They're mostly produced either as spin-offs out of academia or as from startups. Let me start with AI-assisted imaging tools. So this is one big question. Can you establish better diagnosis, or can you monitor the disease better via a better automated or AI-assisted imaging tool? There is a certain landscape already with available products. So if a neurologist is keen on improving the way how imaging is processed and objectified, that would be something to go there. There is clinical support systems that have used huge data sets to train and in a way try to cluster a certain status where the patient is with likelihoods of prognosis. It creates something like digital twins. So if a patient's at this in front of you, how would a typical similar patient develop, or what would this typical patient ideally have as a treatment strategy? So this is a clinical prognosis tool that is already out there and has been tested. What other tools are is information providing tools, something where you get simply relevant informations on the basis of trustful sources. A tool I'm involved in is Copilot. And the idea is having a mixture of a medical dictionary plus AI-assisted ChatGPT, but with a very transparent listing of the underlying sources. So you can pick and choose the sources. You can look up what NICE says, what Cochrane library says, what PubMed says, what guidelines says, or what the library says, and it picks for you the proper references. So simple example, somebody comes into your office and says, oh, I'm pregnant, I'm so happy, but can I continue to take my medications? And we're having something like 20 plus medications available. Do we all know, are they compatible with pregnancy? So you simply look it up and ask, is product A or B allowed to be given during pregnancy, or what do I do? So it's something like a co-pilot to provide you with medical information. I guess this is a use case that we all, in a way, need, because it's not depending on feeding in precise patient data. It's just the existing knowledge repository of the world, but reduced to the trustful sources. And that is, I think, the value of it.
It's amazing how the AI is evolving and embedding into the specialties, in particular neurology and multiple sclerosis, and having these co-pilots and assistive devices helping to narrow the heavily online accessible information into more sort of a readable and digestible way. Equally the same for the healthcare providers and the patients. It's an amazing opportunity to have that curated and available resources that are not just being put on the plate and just read it, but it gives you small chunks of information that you can easily read and digest in an appropriate way. I think these are amazing opportunities.
Yeah, maybe let me add to what you said. I guess the huge advantage to use AI here is just the velocity and the conversational power. We're less and less used to read through 300 pages of a very complicated document. And this is what AI simply can do much faster and better. They are just good in recognizing your intent of the question, and they are looking in texts for what is fitting to your intent. I mean, I guess most of us have worked with ChatGTP and have experienced that it for various inquiries, they are pretty good. They're getting less and less good when it becomes a more complex task or a very specialized task. And this is, for example, the requirement for such a tool to train them properly on a speciality or the medical language or the medical way to how medical information is listed, very similar to what has been done and what is very successfully done in the legal language, which is basically only language based, and a lot of in the medical literature is also language based. This is an enormous power AI has, simply speaking of large language models, but they are not all of the same quality and they have to be trained. But particularly for the purpose to save time, assure quality, overcome language barriers. I mean, this is three arguments why such co-pilots will establish themselves in the future, because I don't think anybody is really able to look in these good old school textbooks or monographies of multiple sclerosis to see what's new and what's up.
Yeah, I totally agree with what you just said, Heinz. And I noticed that more and more people living with chronic conditions such as MS are using digital tools and digital technology. I know that from my own service, and you would be very surprised that the medium mean age of the users of the digital tools are 55 and onwards. They are elderly people. You may think, oh, this is just for youngsters. No. And also our real world evidence suggests that people who's got more severe MS, more advanced MS, more disabled, are more so digital tool users. They want some help. They want information. They have struggles to access their healthcare providers these days, and having that access to AI tool that summarizes and is resourceful and trustworthy, they really celebrate having that information immediately when they require. I guess there are some ethical implications in terms of some hesitancy by the users of the digital tools, and particularly data privacy and mitigation bias in AI algorithms, especially in the context of patient consent and maintaining human oversight. So what are your views on ethical considerations using the AI and using that for educational purpose or diagnostics?
Yeah, this is an extremely hot topic. First and foremost, I mean, when you're talking, and this is not what we were talking about with this Copilot, this has no data privacy issue because there is no real patient data in. But when it comes to tools that use real patient data, either to train the model or to impute, then you have to build it on a safe ground of regulation. And particularly the AI part is a tough cookie. And this is where, for example, the European Union now tries to be a first mover or a front runner. They've created a so-called AI Act because on the one hand, they don't want to prevent innovation, and AI clearly is an innovation. On the other hand, they have to set guardrails that this is not to be done in a very uncontrolled way. Just to explain what, for example, ChatGPT says, I mean, ChatGPT is more or less swallowing every information they can find in the broad internet, and they're reproducing partly in a very creative way out of this answers to your queries or prompts. And how about the publisher rights? You know, is this proper to say, didn't we abuse what others have their copyrights on? And what they argue is, well, they are parcellating and chunking it in a way that it's not anymore the same. And this is a workaround, and there is a lot of court cases at this point exactly about this issue. But coming back to concrete other issues, I mean, when you're dealing with patient-derived data, you have to always keep in mind you have an issue with data privacy, and that has to be handled with care. There is ways to handle it, either working with disclaimers or with consent, but this is clearly something people are very sensitive about. And when it comes to where are those data in the end stored, is the cloud in a EU safe space? Are they shuffled to the US? Is there a software source of unknown property? For example, there is an inbuilt other large language model that is not owned by the tool provider. This is all things you have to clearly describe and make aware. So behind the surface, the UI of a tool, whatever it is, there is a lot of architecture and a lot of shuttling. and I guess your point is clearly true. There has to be a very clean way to handle this with the patient data. So let's say the example is use an MRI imaging from your patient. Would it be allowed to use that with an AI-assisted imaging quantification tool? Yes, it is allowed, but only if the patient name is pseudonymized or the patient agrees that this is to be used in the context of the analysis, because you don't want to be a deal breaker in shuttling or migrating the patient information into a different continent without the approval of the patient. And I guess this is my part of the answer on this ethical sensitivity and on this current gray area between the need for innovation, the want of AI to be integrated, but also being careful about that the rights of the patient or the regulations that we have in the medical professional context are kept.
Absolutely. Patient safety is first. And if you are a patient living with MS, or if you're a healthcare provider, by using open access AI, be careful what information you're sharing, in particular sensitive data such as age, gender, where they live, addresses, etc., etc. The machine learning behind the scenes is carefully learning what you input on the AI tool. So really be careful. There is an implication. It could be a court case if you're not too careful. And all the AI products should be certified and approved to use in a streamline that is not compromising patients' data and patient safety. So I guess we could now go into wrapping up and key takeaway messages, if that's okay, Heinz.
Absolutely.
What key strategies can healthcare professionals use to help patients navigate online health information more effectively?
Well, first and foremost, I guess I would really look for things like, do those tools and helpers have a CE registration? So CE is something like a very bureaucratic. On the other hand, trust creating mark that at least has to provide a lot of quality documentation for the notified body. And that, in my opinion, is differentiating already a lot from what is freely available for whatever purpose. So that is one thing I would do. The other thing is I would clearly talk and ask your doctor why and how is he using what and for what purpose. And the recommendation for the doctor is they should be very, very open. Sometimes they have to do their own experiences and do a pilot. But I guess my key statement in the end is that the future neurologist will not be replaced by AI, but the ones that use AI will replace those that don't use AI.
Wonderful. This is such a powerful statement, I have to say, Heinz. And just to fantasize a little bit and thinking about the future, what do you envision, like, as a general neurologist who hasn't got much expertise in subspecialty like MS or Huntington disease or many other rare or common neurological conditions? Do you see them going to their clinics and one screen is going to be patient notes and electronic healthcare records opened on their screen, and the other software is going to be opened as some sort of an AI tool which is going to help to maybe predict patients' outcomes, maybe clarify diagnostics, maybe advise some further tests and investigations that this patient should undertake? What is your sort of, in the next, let's say, 30, 50 years, what is your vision? How it's going to what our sort of approaches are going to be in our clinical spaces?
Yeah, I guess so. The neurologist 2.0 or 3.0 is a person that is still in a lot of conversation with his or her patients, but some tool in the background is recording and making these conversations into text, but also into fruitful discharge letter and integrating it into the patient history. So when your patient comes every 3 months, the recent conversation is taken as a basis, and you see this to be of value for the individual course. So that saves time and creates quality. So this is one thing. The other thing is that I guess tools like the Copilot that I mentioned will be a standard, because you look it up and you easily use it like you use your iPhone or iPad for whatever purpose. It's like your Swiss Army knife for whatever. Plus, in certain specific areas, you have more dedicated tools. So I don't think there is something like for all neurological diseases, they will be all assisted in the same way and in the same power by AI. But for a disease like multiple sclerosis, there is so much value and clear development path that things like a digital twin and a patient monitoring AI assisted tool will be hopefully the future there. So I guess the neurologist 2.0 is much more digital, including AI tools, and this saves time and enhances quality. And for some diseases, goes beyond that, so that really have you a more glass-like patient. But in the end, I don't think even in 30 years it's done without a neurologist.
Wonderful. Such a great overview of what we just discussed. I think the future for neurologists is bright, and as we move on, we will develop more and more tools assisting and enhancing the healthcare that we provide day to day for our patients that we value the most. As we wrap up this illuminating discussion on the role of AI in healthcare education, I want to extend my deepest thanks to Professor Heinz Wiendl for sharing his expertise and vision. His insights into how AI can enhance both the accessibility and accuracy of medical information have been truly, truly inspiring. Professor Wiendl's commitment to advancing healthcare through both his research and his leadership at some of the world's most prestigious institutions reminds us of the critical importance of innovation in medicine. As he prepares to embark on his new role at the University Hospital Freiburg, we look forward to the continued impact he will undoubtedly have on the future of neurology and neuroimmunology. Thank you to the listeners for joining us today. Be sure to stay tuned for upcoming new episodes of Moving Science podcasts, sponsored by Roche, where we will continue to explore the intersection of technology and healthcare. If you want to follow Professor Wiendl's or my work, you can find more on LinkedIn. Until next time, this is Dr. Agne Straukiene and Professor Wiendl signing off from the Moving Science podcast.